eating less than they should because of financial reasons, having 4 or more alcoholic drinks in a day, using tobacco products, including vaping, taking prescription drugs in a way other than attended, using illegal drugs, having little interest in doing things, feeling down, depressed, or hopeless, feel tense, anxious, or worried, and have thoughts that you or your family would be better off if you were dead. And then you'll notice right below that question that is related to suicide, we do have the National Suicide Prevention Lifeline phone number bolded, and I think it's a font size bigger so that it's fairly obvious there. Any questions on this block? We can, if you think of a question too, as I'm going through this, then we can always go backwards as well.
No questions so far.
Great.
So just a quick, Lauren, just quickly, is it like, are you asking, is it in their lifetime? What is the time period? Eat fruit and vegetables. So, oh, how often? Never mind. Sorry. Okay.
Yeah, but that's, that is a good point. We could add, in the past year, how often, or in the past 24 months. So we can. Okay, the next group here is about access to healthcare. So do you have services in your preferred language, written communication in your preferred language, someone who can answer health-related questions, a way to view your medical records online, addiction and recovery services, affordable contraception, preferred contraception, sexual health information and counseling, testing for sexually transmitted disease infections, family planning counseling, prenatal care. And then the options range from all the time to never. And then we also included an NA.
So here also.
Go ahead, Dr. Bonnie.
So here also, I think you should add in parentheses some example of sexual transmitted infections. Not everybody probably knows what are the. So the most, add some common one like that you.
Yeah, so this is Jim Heckman. You may also want to include gender affirming therapies or
Yep.
hormonal therapies.
Great. And I think we have a comment from Laura, mental health services, which I think maybe categorized as mental. We should probably also add addiction to that, behavioral health, just generally, but to your literacy point, Dr. Mike, making sure that it's clear that we're talking about both. Great. Okay. Any other questions on this section?
Sorry. Is this where there would be questions? I just think mental health is so huge that just only having that one question. Is there more later on? I can't remember.
So we do ask these 2 questions, or these,
right?
let's say 4 questions here, but and then up in the top section about in the past year, have they visited? There's support groups, there's therapy. So I think that's where we have it, but if we need more.
I just feel like so many people, they may have that stuff, but they can't figure out how to connect or actually find a mental health provider that they can walk to or get to in Lakewood. Or, that's what I hear from a lot of families, is being able to find for their children, their teens, or, themselves, affordable, easily mental health providers. So I'm not sure exactly where, but I feel like there needs to be something more about that. So I see that as a problem.
Okay, so something that's a little bit more specific to behavioral health services.
Yeah, if you think that's okay. I don't know. I'm not the health expert on here.
Yeah, we certainly are documenting behavioral health challenges, incorporating elements of ACE screening questions, other utilization questions. This access question, I think we can build out a little bit. We'll have to balance that with how the format's going to work, right?
Right. Yeah.
But yeah, I think it's a good point, and we'll try to engineer something that makes it clear for anyone who's a respondent.
Thanks.
And I just wanted to ask a question. I know it's been brought up with childcare, but a lot of these questions are aimed at the individual and not the family. And I also know that there's going to be a lot of feedback collection that happens after this survey, but whether there's any potential for youth feedback in this. I'm just thinking that, you know, if this goes to a household, presumably wherever there's a youth or teenager, there's also parents, but if they're answering in their own mindset for their individual, this mental health list of questions, there's just a really distinct difference in the ability to access mental health care for youth versus adults. It's such a more limited pool of providers for youth. I think if this survey were aimed at both individuals and their families. So if the questions were worded, do you or you and your family, it might help people answer, taking into consideration others in their household as well as themselves.
Yeah, I think, and I asked Emily to flesh this out a bit. This is very intentionally designed, and we have a limitation in that the randomization premises households. That being said, I think we have a convenient survey that we will develop, and I think we also want to lean on other scientific processes with key informant interviews and focus groups, and we've identified sort of adolescents and youth as being a part of that focus, because necessarily you're not going to have a 14 or 15-year-old be listed on an address in all likelihood. So
Yeah.
so we'll need to fill that in with certain demographic groups, and that's going to be one of them.
Okay.
So another point before we leave the behavioral health consideration, and this is only something to think about. We're screening for ACEs, but we don't specifically ask about trauma-informed care services, ability to link to those. I think that would be helpful to know if there are trauma-informed services if we're going to screen for ACEs, but that's more of an opinion than, you know, medical fact.
So I guess my question is trauma-informed care a widely enough used term for the general public to understand it? I know in my professional world, and it's a term we more commonly use, but I'm a little bit disconnected from what other people, how common it is to other people.
Yeah, maybe it's not that common now that I think about it, but yeah, I think people are becoming more familiar with it, but certainly it wouldn't be known by the general population necessarily. I'm getting more out of personal bias, which is don't screen for trauma if you're not going to treat trauma, because then you label someone as disabled with trauma and you got nothing to give them. I'll just think about that for a while. Thanks for listening.
Now I'll scroll us into this section and then also share that this is a continuous conversation we've been having internally, also with the steering committee. And we've also enlisted some experts on trauma and on trauma-informed care and ACEs screening to help guide us. So one of those is Dr. Laura, and forgive me, Lauren, I can't remember her last name.
Dr. Leanne Chrisman.
I forgot the name.
You know, Dr. Heckman. She helped us walk through these questions and also how we go about answering them. And then also we still have the premise of the Case Western model for trauma-informed research. And then yesterday, all of us attended a training on what is trauma-informed care and what do you do about it. Mind you, there's two parts to this project too. There's assessment and then action plan. The critique that the Surgeon General of California received after sort of mandating providers conduct the ACE screening was, well, then what? completely an appropriate critique. I think what we're hoping to achieve here is that first level of documentation. We will have some sort of demographic and geographic insight relative to that documentation. And then I think it's our responsibility to work with all of you about, so what do we do about this information? But keep in mind too, that we do very clearly list out in that section, contact 211, here is some additional information. If we notice that there is significant or higher scores in certain geographies or certain groups, I think that really helps us talk to all of you as providers and as community resources about, well, in the action plan, what are you going to do with this information? So it's an excellent point to raise, because I think we don't want to put ourselves in the position of, say, pathologizing whole communities and then not creating resources that are commensurate with that need.
Good points. Thank you.
So this is the section here under personal experiences. And we do, at the very top, we start with the sentence that essentially lets people know, like, we understand if you don't want to answer these questions, just skip it. And that's honestly true for the whole survey. We're not sitting there with people, so they can skip whatever they want. But we just wanted to give people an absolute sort of like feeling that it was completely okay not to answer questions that were making them feel particularly uncomfortable. So that first set of questions there is an ACEs screening. And then the next question 112 is, and I guess I should pause. So ACEs is adverse childhood experiences, and it's based on research that those who experience a certain number of adverse childhood experiences will have impacts into their adulthood that both impact their physical and mental health. Obviously, it's not guaranteed that you're going to have negative health impacts, but the likelihood of it increases with the number of ACEs you experience. And that's like the very social sciencey version, not the well-researched version that some of you probably have much more knowledge than I do. So we ask also, do you believe that these experiences have affected your health? We have a question about experiencing gun violence, whether it's been directly experienced, witnessed, someone in the family who has witnessed or experienced it. Then the next group of questions here is based on a discrimination scale. So there are questions here that ask about different types of discrimination and different instances, and then asked about the frequency of occurrence. And in addition to discrimination, we also wanted to have information about people's resiliency. And so the next grouping of questions is based on a resiliency scale that came out of OSU, research done at OSU. And again, we have the scale that goes from strongly disagree to strongly agree on a different and how people respond to stressful events.
Emily, we got a quick note from Michelle. Please include a note on the survey that provides contact information for anyone who needs an accommodation or assistance to read or complete the survey, thinking about barriers such as low vision, or how to increase awareness to elicit participation from residents who are not readers due to language or other barriers. Do you have any insight on how we typically manage those sorts of challenges, or how we may approach that question?
Yes, so in our intro letter, it is probably from the mayor is probably the best place to put that information. And I think we can easily work that in to request accommodations. We can also, if we decide to do the piece of paper that requests translation, we can put something in really large print there to request it in large print. Okay, the next grouping of questions here is about community connections. And this is, the first group of questions is actually based on the UCLA loneliness scale. And this is the 6th version question of the scale. The next one are questions about how connected people feel to their community and how civically engaged they are. Do they trust local government? Are there opportunities for residents to participate? Are community events accessible for people of all abilities? Free and accessible places to meet up with friends or family? Feel a feeling of safety when attending events? Events in Lakewood are culturally diverse. I have a place to worship within Lakewood. If I want to volunteer in Lakewood, I know how to get connected to opportunities. And we have 3 options for this one: agree, neutral, and disagree. The next 3 questions here are related to race. And so the first one is, how would you rate race relations in Lakewood? Ranging from very good to poor and also a not sure. Does experiencing racism impact a person's health? And then, do Black, Indigenous, and people of color, also sometimes referred to as BIPOC, experience racism in Lakewood? Yes, no, and not sure. Then we have 2 open-ended questions. What are some ways people in Lakewood become connected to their community? And does being connected to a community impact a person's health? Please explain.
I think I would like to see maybe another question related to racism, related to immigration status or refugee status. There's a large community in Lakewood. As an immigrant or refugee, do you believe you experience?
So now I can't remember if we included that as an option in our demographic section. If we do have citizen status in there, but if we don't, we can add it, and then that would allow us to be able to see, whoever checks the refugee,
Good.
then we can go back and look at those answers specifically. So I think that would be the right place to add it in.
And I think too, Jessica had noted, could we add, are you connected to your community by social media? It's a good question, and one that may be useful for our promotional efforts as well. So.
Also, can you go back to the race question?
Mhm.
Glad to see that one there. But another word that comes up is biases. I'm not sure where it will fit in here, but maybe do you feel bias or any biases in the community or something like that?
Yeah, I think we can try to wordsmith that a bit.
Yeah.
Part of our interest here too was, and this is something we try to address in regards to just survey bias in general. You want to make sure that the questions don't elicit predictable responses, right? You don't want to engineer something to where how people respond is less accurate or somehow doesn't get you the information you're interested in. So I think part of what we tried to do is, number one, by collecting demographic information and then also asking about discrimination, we can see if there's relationships that exist. So if we ask about immigrant status and then have you experienced discrimination directly using that discrimination tool, hopefully that elicits some response. But to your point around bias, I think we can look at, does that tool adequately bring out some of those questions, or is there a way to fit in the specific notion of bias into the questions that are being asked? I think we can look at that.
Yeah, because I want to see some correlations here, not just with race, but disabilities and the transportation questions and all kinds of questions. So there might be some correlation with the word bias too as well.
Gotcha. Yeah, and we do plan on reaching out to the ADA work group of the city to help us detail out some of the language related to disabilities. I just wanted to call that out because that was one of the areas that we were trying to wordsmith a bit. So thank you for the input.
Okay, moving on to financial health. Do I have enough resources to buy food I need for housing, for utility bills, medications, medical bills, money set aside for an emergency, making contributions to savings accounts, being able to retire when I want to, and to not worry about money. And then we have options ranging from nearly or never to always. We also have a few questions here, multiple choice. If you needed to borrow $500, do you know someone who can lend it to you? Do you currently have debt? And if so, what kind? What is your current employment status? Does your current employer offer sick time or paid off? How often does your family have money left over after paying your monthly bills? I think maybe this could be a place where we add in a childcare question. Like, do you ever have difficulty finding childcare that impacts your ability to work or go to school? Something along those lines. Does that sound like a question, like a good place to put it to others?
I think so. I think it needs to be in there because that's a huge, and Emmy can probably speak to that too.
And also, Emily, we had a couple of comments, one from Laura and one from Allison. From Laura, some more detail around feeling connected. I responded that we might just want to take a look at that. There's no specific recommendations, but generally, Laura, and to everyone on this group, if things occur to you, always feel free to send them our way. We want to try to finalize this in the next couple of weeks, but if you come up with any thoughts on specific things, feel free to send our way. Allison's comment was if we could add property taxes and ask if they are homeowners, if they receive the homestead exemption. And then Laura also asked, does your employer offer maternal or paternal leave? Which I think blends itself nicely into this question around childcare and resources related to childcare. Family supports.
Oh, I'm sorry. I know this sounds crazy. What is the homestead exemption if you're an owner and you live in the house?
Yes, I believe it's for older adults.
Older adults. Okay.
And you have to
Oh.
meet income requirements.
Yeah, fixed
Got it.
income.
That's what I thought. Could you add the question if you are an owner and do you live in your house? Because there's some like duplex and stuff that owners live in, and then they get a credit from the county, I believe, on their taxes.
Yeah, this is
I
actually,
think it's called owner occupied. So yeah, there you go.
yeah, I think this is one of the areas that we're interested in. We're going to be paying attention to. The reason being, renters are an important category of folks we want to hear from. So we'll be monitoring the responses and also looking at ways to do specific outreach to rental groups. And we've talked to the city about what resources might be available to do that. So, as we come back to you and as this is being implemented, we may need some of your help reaching parts of the community. And this is one of them that we've identified as being something that we are going to try to pay close attention to. So these particular questions can help us understand who's a renter and who's not. It may be obvious in certain circumstances, right? Apartment 1 or 4 or what have you, but in other ways it may not be as apparent. So we'll continue to pay attention to that, and I think some of these questions might be useful to illuminate some of those challenges and differences with those challenges.
And if I could just add, for the homestead exemption, there are 12,600 1- and 2-family homes here in Lakewood, 50,000 people. And it's roughly, I think, only 500 people who are taking advantage of the homestead exemption, which for our seniors who are on a fixed income, this could really make a huge difference in their lives. So that's why I suggested it, because we'll be able to see how many folks are taking advantage of it. And as well as that owner occupied credit, there are people who live in their homes who are currently not getting it, and they should be. So I think it's a great question to add as well.
That lends itself well to, we might be bringing this back up during the action plan phase, Allison, too, if we see some disparities between eligibility and people taking advantage of it. So thank you for that.
We have 2 open-ended questions in this financial section. Does debt impact your health? If so, how? And how does your financial well-being impact your physical and mental health? The next section is where we collect demographics. So we ask how many people live in the household, how many are adults, how many are children, and then if there are children in the household, what are their ages? We ask about gender, and our options are man, woman, and self-describe. We ask for age with a couple of different age ranges, annual household income, language that is primarily spoken in the home, sexual orientation, and our options are asexual, gay, lesbian, pansexual, queer, same gender, loving, straight, and self-describe. Race and ethnicity, marital status, highest level of education, are you Hispanic? And this section right here is a place where we can nicely ask about immigration status or citizenship status. Dr. Bendick, do you have a preferred way that we would ask that question? Like, is it better to ask about citizenship or immigration? Or I want to ask it in a way that doesn't feel threatening to people who may not have citizenship status.
Maybe citizenship section, because citizenship question, because place of birth doesn't indicate anything in terms of whether they're a citizen or not. Your current citizenship status, you can give some option. Permanent resident, citizenship, awaiting, or refugee status, because especially the people that I have interacted with, those who come here as a refugee status, they're very open about disclosing their status. So having that category, I think, could be beneficial. I do have a question about the gender. Actually, the best practices of gender information, maybe it's not the same way to ask this question, asking about birth gender, current gender. The 2 steps question would probably be helpful.
Thank you for that. We had a question from Laura. I think I can answer, Emily, which is, should we move this to the beginning so people know to answer the survey better? I think what we try to do with these is we feel like the flow for this tends to work better for full completion, to keep the demographic at the end, but I don't know if you have any additional thoughts on that.
Yeah, we tend to leave it, put these questions in the end. Particularly, we have found the household income one is one that people kind of shy away from, don't feel comfortable answering. And sometimes if they see it right away, we suspect that they just throw away the survey. So it's a technique to keep the survey response higher.
And then Jessica had a question on 175. Could we add do not want to answer? This is the sexual orientation.
Yep.
Yeah.
Could also do that in gender. And I agree with Dr. Bannock. I would include gender assigned at birth. What is your gender? What was your gender assigned at birth? And what is your gender identity?
Yeah.
That might be what's going on with the
And that leads us to our final page, which is a map of Lakewood. And there's a line here that says, please use an X to indicate about where you live in Lakewood. We did want to keep these surveys anonymous, but it is also useful to know about where people are living. So we have the map here, and you can probably, if you're familiar with Lakewood, which I'm sure you all are, you recognize these as the 4 wards of Lakewood. And so this will allow us to fairly easily, hopefully, identify which wards people live in. It'll also help us, one of the things that this will help us with is where the surveys are coming back from. So if we find that we're getting a bunch of surveys back from Ward 2, but almost nothing from Ward 3, then that will shift how we do some of our outreach for the remaining portions of the assessment. And that's it. We've made it all the way through. But I would welcome any questions, comments, suggestions, overall feelings, reactions.
One question from Emmy Some any questions about composition of household, multiple children, multi-generational, gives context to household income questions too. And I do believe we have a section on that.
Yeah, we ask about children. What we don't ask if there are like grandparents living in the household or other unrelated adults living in the household. And so we can see,
Mhm.
work that in.
It's probably less common than it would have been at another time.
Well, I don't know. I mean, I think yes, but also there are.
Oh, I see. You know what? I'm sorry. I do see with 164 to 166.
Does that
So-
answer your question, Emmy?
Completely.
Okay. And then Jessica and then Dr. Heckman. Jessica asked if are any, you also do not ask if any children are on an IEP. So Jessica, I'm assuming this means asking if any of the children are on an IEP as being an important.
Yes, because like my son is on an IEP, and there were services I didn't realize once he was on an IEP
Mhm.
that they provide for the family.
Okay. And I see Laura says, or a 504 plan. So perhaps maybe weaving those questions together or around the same section potentially. Okay. And then Dr. Bonick, well, first we'll go to Dr. Heckman.
Yeah, thank you so much. This is a lot of work. What a great amount of activity assembled, and I think it's very exciting that you guys have really put together a beautiful product. The question I had was about exercise. I feel like maybe this is a little light on exercise, or did I miss the areas that got at that? I could have missed where you.
Yeah, there's essentially one question, and it's how often do you engage in exercise for at least 30 minutes?
Okay, I'm gonna send a couple questions. You may want to think about use them or not.
Thank you, Doc. And it's in the chat, Tanisha and Emily, so we'll make sure. we
Also,
take a
one
look
more
at
thing, sorry, and I'll shut up. Intimate partner violence. I didn't see anything about that. That may have been a choice, but maybe that's something you might want to think about.
Okay.
I don't think there is anything about intimate partner violence, so we'll think about how we might include that. I think it'd probably be on this page.
I'm going to get to Dr. Bonick's question, and then Laura, I see your digital hand is up. Dr. Bonick had mentioned he had to go, but any question about housing quality, particularly related to lead? I know that with Cleveland, how they've tried to address this is asking if they know their house was built before 1978. I believe that the city has this information available in regards to housing stock generally, but did you have a specific way that you think that question should be asked?
No, I think that's good. I didn't realize that there was already a question here. Late
Okay.
vent, late pipes, and if city has the data, I think you can collect that.
Okay.
I mean, there's 177 questions, so it's easy
Yeah.
to miss one or two.
And then Laura,
Thank
I see
you.
your,
It's good work.
thank you very much. And of course, if you have any follow-up, don't hesitate.
Yeah.
And then Laura, you have your hand up.
Yeah, so I appreciate what Dr. Heckman said, because I did see that as well, that we really only had one question really about physical exercise. So I just put in the chat also about access to affordable, like, I know we have the rec and the Y, but I think sometimes people don't know the rec's there, or they, whatever. But access to affordable venues to work out or stuff. I do think physical health in terms of exercise and all of that is maybe underrated in here. We're not given enough to some of that stuff.
Yeah, I appreciate that comment. I think, in this thinking of the section about your neighborhood, asking about, feelings of safety in their neighborhood, safe sidewalks, safe pedestrian crossings. We're trying to get a sense of whether or not people feel safe walking around their neighborhood, but I think maybe making it a little more explicit about whether people are getting exercise and feel like they have the space to do that is something we can add in.
Yeah. And then also I think back to family stuff, I feel like we asked about the mental health for the children and all of that stuff. I mean, I guess maybe pulling, like Emmy said earlier about pulling that out, but I still just feel like there's, if I'm thinking of some of the families that I would ask to take this survey, they would probably, if they turned it in, it would probably look glowing, like everything's good in their life. But I know there's deep issues just around caring for their children.
Mhm. So maybe there's like another small entire section where we need to add in specifically related to family issues families have, and put the education questions, the childcare questions, the mental health for children questions in
Yeah.
there, which may mean we shrink down that map, but honestly, I'm not sure a map needs to be a full page. So that is kind of the space that we would use.
Yeah. But beyond that, it's amazing, beautiful. I don't want to like say I'm just like criticizing here.
No, we are asking for your feedback and input. So we are thrilled that we're getting wonderful impact in feedback and input. It would be far more difficult if nobody was saying anything.
Definitely. And always keep in mind too, I know I've hit on this point a few times, but if there are particular constituencies or populations that we need to talk to outside of this survey, we should do that, you know. So this is a modality, but it's only one of several that we are going to use throughout this process. So if there are like family groups or organizations or affinity groups that we need to have more intentional conversations with, I think we would like to encourage that and would ask for your help in identifying who those folks are. And how to
One
connect
more
them.
question then.
Mhm.
I think in terms of education, I think that in that family section, maybe then Emily have about quality of education. You know, if we think about if we're looking at how we're healthy, if families are deciding if they're staying or going in Lakewood based upon what they see as the quality of education for their children.
Yep.
But
That's a great idea. One of the challenges as the survey writer is getting all of this information into a survey that is short enough that people are willing to take. So my job over the next few days is to try and, adjust formatting, shrink some things, build some things, and seeing what we can fit in. So there's many wonderful suggestions here. We'll try to incorporate as many as we can, but just also please be patient with us and understanding that if we don't fit every single thing into the survey, there are other opportunities we'll have to gather information. And so if there are things that we can't make work in here, we can always ask those in focus groups and convenient samples, in convenient sample surveys and interviews. But I will do my best to make it all fit together.
If I could ask, I'm sorry, I just took another look at the survey here. Anything about aging in your home? Do you feel safe in your home? Do you have trouble with mobility in your home? I mean, that could be for anyone who has mobility challenges, but I work primarily with a senior population, so it's top of mind for me.
So Allison, I do think we will be doing focus groups. I think we've already identified older adults as a primary group that we want to hear from through focus groups. And we have, Community Solutions has done a number of older adults needs assessments that we can draw on to do a specific facilitation guide or convenient sample survey for that group. And so I think just because of the length of the survey already, we would save that for that specific outreach. But I agree, it's an important question. And usually when we ask, do you want to live in your home as you age? The answer is a resounding yes, which then helps provide a justification for further supporting programs for older adults to help them have those supports they need to age in place. So I'm right there with you, but I'm not sure.
They want to stay. They just need to figure out a safe way to do that.
Yeah.
Great. Thank you so much.
Okay, so first of all, Emily Matillo is a hero. And she has now gone through this process several times to try to incorporate some feedback. So I think first of all, it's a big survey, right? But you have to trust us. We've done this before. Given the amount of distribution that we will have, and where we feel like we will be able to promote, we feel very confident that we'll get a good response. I think we've also tested out the average length it takes to fill out the survey. And most folks, I would say that we've gotten between 10 and 30 minutes on average. So we're gonna learn more about that and try to refine it a bit. But a few things to highlight here that I think are really important is that, number one, we're trying to document social determinants of health. That's a big imperative of this project, trying to understand what people's needs are that relate to health but are outside of health. Number two, understanding sort of people's background with adverse childhood experiences, understanding what that looks like, where that looks like, where the differences might be in terms of geography, so on and so forth. Discrimination, if people have experienced discrimination, what does that look like? And ultimately what the differences might be between different folks. So, with the context that we'll be able to provide and the types of questions that we're asking, we'll get a lot of information about where we might see some differences in various community experiences. And then, of course, that will lend itself well to the additional community-based engagement work that we're going to do. Please, if you think of anything over the next few days, send it our way. We want to incorporate as much feedback as we can, as we practically can. And if we need to have more intentional conversations just because of the space and the cost and the size of the survey, like with older adults, we plan on doing that. I also just want to take a moment here to highlight that it is very cold outside, but case rates are starting to decelerate, and we are currently planning on doing our community engagement work out in the community, showing up at events, holding events, virtually and in person. Obviously there's a lot to be determined about this current wave, and we want to make sure things are safe, but this is one of those areas, as we continue to meet, we'll need your help in identifying the best ways to do that. When is it appropriate to do virtual versus in person? Where can it happen? How long should they be? Who needs to be interviewed? That sort of thing. So we're going to lean on all of you to help us in that process. But our plan right now is to finalize the survey, to develop some promotional materials that we will provide to all of you so you can distribute the information out into your networks to say, hey, this survey is coming. It's really important for our community. Please fill it out. And if there are any questions that come out of that, to direct people to the resources online or to us to help facilitate that process. So I don't know, Emily, is there anything else that you would like to add about the survey or the additional elements of the survey work that we need to do?
Just a very big thank you for all of the feedback you provided today. It is so useful in helping us figure out a little bit to make it a better survey. So I really appreciate it. Thank you.
Great. Is there any other feedback or questions from advisory committee members for us at Community Solutions? And it could be related to the survey or just generally whatever you'd like to discuss. Okay, that's good. So we will thank you again for your patience today. And I know this the tedium of going through a survey can be challenging, but if there's anything that you need to address or would like to address with us, reach out. We will post a recording of this committee on our website at communitysolutions.com/liquidhealth. And with that, I guess we will break. And I want to thank you for your time and energy. And we will see you in about a month.